There's widespread agreement that it's important to help older adults and people with disabilities remain independent as long as possible. But are we prepared to do what's necessary, as a nation, to make this possible? That's the challenge President Joe Biden has put forward with his bold proposal to spend $400 billion over 8 years on home and community-based services, a major part of his $2 trillion infrastructure plan. It's a historic and profound opportunity to build a stronger framework of services surrounding vulnerable people who need considerable ongoing assistance, said I-Jen Poo, Director of Caring Across Generations, a national group advocating for older adults, individuals with disabilities, families and caregivers. It comes as the coronavirus pandemic has wreaked havoc in nursing homes, assisted living facilities and group homes, killing more than 174,000 people and triggering awareness of the need for more long-term care options. But prospects for the president's proposal are uncertain. Republicans decry its cost and argue that much of what the proposed American Jobs Plan contains, including the emphasis on home-based care, doesn't count as real infrastructure. Though this proposal is a necessary step to strengthen our long-term care system, politically it will be a challenge, suggested Joseph Gogler, a professor at the University of Minnesota's School of Public Health, who studies long-term care. Even advocates acknowledge the proposal doesn't address the full extent of care needed by the nation's rapidly growing older population. In particular, middle-income seniors won't qualify directly for programs that would be expanded. They would, however, benefit from a larger, better-paid, better-trained workforce of aides that help people in their homes, one of the plan's objectives. This plan isn't everything that's needed, not by any step of the imagination, Poo said. What we really want to get to is universal access to long-term care. But that will be a multi-step process. Understanding what's at stake is essential as communities across the country and Congress begin discussing Biden's proposal. The services in question. Home and community-based services help people who need significant assistance live at home as opposed to nursing homes or group homes. Services can include home visits from nurses or occupational therapists, assistance with personal care such as eating or bathing, help from case managers, attendance at adult day centers, help with cooking, cleaning and other chores, transportation, and home repairs and modifications. It can also help pay for durable medical equipment such as wheelchairs or oxygen tanks. The need. At some point, 70% of older adults will require help with dressing, hygiene, moving around, managing finances, taking medications, cooking, housekeeping and other daily needs, usually for 2 to 4 years.